Good afternoon, everyone. Thank you for joining us today for our webinar. My name is Dr. Kimberly Fowler, and I'm the Director of the Technical Assistance and Research Center here at the National Council of Urban Indian Health. And today, Whitney Hewlett and I, who's a TARC intern, will be presenting a seminar on tips for mental and substance use disorder patients, how to use your coverage. If you could please write into the chat box where you're coming from, what your location is, and what program you're coming from, it would be helpful to us just to know who's involved in the webinar. This webinar is sponsored by the Substance Abuse and Mental Health Services Administration in partnership with Truven Health Analytics and NCUE. I'd like to take a brief moment to introduce Beverly Lorton, who is going to help us answer any questions and refer you to resources during the webinar. She's coming from the Centers for Medicare and Medicaid Services, or CMS, with the Division of Tribal Affairs. She'll be available to answer any questions as they come up during the webinar in any area. So while you're typing in the your info in the chat box, please take note of the Q&A pod that's located directly below the attendee pod on the lower right hand of your screen. In order to ask a question during the webinar, type in your inquiry into the Q&A box at the bottom of the pod and click the button on the right. This will allow us to gather questions so that we can have a Q&A portion of this webinar towards the end. However, if the question is able to be answered by Ms. Lorton, she will also respond to you directly as well. Disclaimer that the views and opinions expressed during this presentation do not necessarily state or reflect those of SAMHSA, the Department of Health and Human Services, or the U.S. government. The National Council of Urban Indian Health, or NCUE, is a nonprofit membership-based organization that represents the healthcare interests of urban American Indians and Alaska Natives. Based in Washington, D.C., NCUE provides the latest information on policy, training, and research involving urban Indian health. These programs are funded by the Indian Health Services under Title V of the Indian Healthcare Improvement Act and serve approximately 138,000 American Indians and Alaska Native patients every year. Our programs are often the main source of health care and health information for urban Indian communities. So in this role, they have achieved extraordinary results despite the great challenges they face. Our 38 member programs operate in 41 cities across the country, which are largely located in the same areas that were previously identified as relocation centers. Even though 78% of all American Indian Alaska Natives live off reservation, funding for UIHPs is less than 1% of total IHS appropriations. This last point highlights why it is so critical for American Indian Alaska Natives in your community to take advantage of opportunities that are now available through the Affordable Care Act. So I'd like just to give a short overview before we get started on what this webinar will be about. There have been over 8 million people who have been able to enroll into the marketplace insurances, including American Indian Alaska Native consumers. This success has been in part due to our on-the-ground assisters and navigators that have been able to answer questions, outreach and educate, and enroll consumers in their community. It's important to now for consumers to understand that what is covered in your insurance and how you can use their coverage to receive medical services, their coverage. Now that these consumers have received their access to health insurance in the form of an insurance card, it is important for them to understand what are the next steps to using their coverage, especially for those that may need behavioral health services. Our goals for this webinar are to highlight the new behavioral health coverage priorities that have been brought about through the ACA and the Mental Health Parity and Addiction Equity Act, and provide simple steps that you as an assister or provider can take to help individuals with mental and substance use disorders to access care. So now I'd like to turn it over to Whitney, who will go into more detail on these mental health benefits.
Okay, thank you, Kimberly, for the introduction. As just mentioned, an important population to consider in this new pool of insurance users are consumers who need behavioral health services. In our first section, we will take a quick look back at the new mental health coverage that came into effect with the ACA and its benefits for behavioral health consumers. With the passage of the ACA, there are 10 essential health benefits that all qualified health plans are required to cover. You'll see that some of these benefits are services that are not available at every clinic, particularly behavioral health and pediatric oral and vision care. However, all health insurance plans in the marketplace must cover these 10 categories of essential health benefits. This includes mental health and substance abuse disorder services and behavioral health treatment. So in terms of the benefits for individuals with mental and substance use disorder, the ACA will expand access to coverage to over 33 million previously uninsured individuals, including over 11 million who have mental health and substance use disorders. Also important to note is that 3.7 million people with severe mental illness will gain access to care through Medicaid expansion, subsidized private insurance for those who are not Medicaid eligible, and employer-based coverage. Mental and substance use disorder services, as previously mentioned, must be covered as essential health benefits. And finally, no plans will be able to deny coverage or charge higher premiums due to pre-existing health conditions, including mental and substance use disorders. This change in particular will benefit people with mental illness who have typically faced coverage denials in the past because of their existing behavioral disorders. And also to note, there are no lifetime or yearly dollar limits for mental health services. So the Affordable Care Act requires both employer-based and health insurance plans sold on the health insurance marketplace to offer coverage for mental health and substance use disorders. This coverage includes behavioral health treatment such as psychotherapy and counseling, mental and behavioral health inpatient services and substance use disorder treatment, some prescription drugs, lab tests, and preventive services, which I'll go into more detail in the next slide, but these will include services such as screenings for depression. More specific healthcare benefits can vary by state, and even within the same state, there can be small differences between health insurance plans. For consumers, it is important to compare plans to determine what the specific healthcare benefits are that each plan offers. Many of the covered behavioral health services provided in the marketplace health plans are for preventive type services. All qualified health plans are required to cover with no cost sharing preventive services that have received an A or B rating from the U.S. Preventive Services Task Force. These include depression screening for adults and adolescents, intimate partner violence screening for women of childbearing age, tobacco use counseling and interventions, alcohol misuse screening and counseling for adults aged 18 and over, behavioral assessments and developmental screening for children under age 18 at certain intervals, and autism screening for children at age 1.5 and 2 years. So now that the ACA has expanded coverage for mental health and substance use benefits, the next step will be to ensure that individuals with mental and substance use disorders are aware of the new benefits that are available to them. This population is vulnerable as their health care has traditionally been inadequately addressed. As a result, people with mental health and substance use disorders face numerous barriers to better health outcomes. So some of the barriers that are relevant to this population include that people with behavioral health conditions make up a large proportion of the uninsured population. Many individuals with behavioral health conditions are also unfamiliar with health insurance and its value, or lack the awareness that they are eligible. Also, individuals with mental health and substance use disorder are 6 times more likely to lose coverage than individuals with other health concerns. And for behavioral health patients, symptoms and structural issues such as poverty and housing instability can create challenges for getting and keeping coverage. Periods of uninsurance can often lead to increased inpatient and emergency visits, longer hospital stays, worse psychiatric outcomes, and higher healthcare expenditures. And traditional outreach workers have limited training in working with individuals with behavioral health conditions. So given these barriers to care, the ACA works in conjunction with the Mental Health Parity and Addiction Equity Act to address gaps in behavioral health care. The Mental Health Parity and Addiction Equity Act of 2008 was enacted to expand upon the Mental Health Parity Act of 1996 through the inclusion of substance use treatment. The MHPAEA mandates large group and self-insured plans that are already providing behavioral health care to offer copays and coinsurance that are equivalent to physical health services coverage. The law's enactment, however, was found to be inconsistent, with about 1/3 of healthcare plans not complying with the law in 2010. So the Affordable Care Act extends the parity requirements for mental health and substance use disorder benefits of the Mental Health Parity and Addictions Equity Act to provide the essential health benefits package. So the Act protects Americans by limiting restrictions on coverage for mental health and substance use disorders in 3 ways: financial, treatment, and care management. So with financial requirements such as copays, coinsurance, or out-of-pocket maximums, these cannot be more restrictive for mental health and substance use disorders than they are for medical and surgical services. Regarding limitations on service usage, such as inpatient or outpatient day visits that are covered, these cannot be more restrictive for mental health and substance use disorders than they are for physical health coverage. And other types of treatment limitations, such as the determination of medical necessity requirements, must be applied in comparable ways to both mental health, substance use disorders, and medical and surgical services. So one of the next big challenges with when it comes to behavioral health care will be care integration and coordination, which recent legislation has been passed to help address. So the Excellence in Mental Health Act, which was passed in March 2014, increases access to community mental health and substance use treatment services and establishes better Medicaid reimbursement for these services. It addresses some of the current barriers to behavioral health care provision, mainly including spending legislation, which generally encompasses funding for established safety net providers, such as federally qualified health centers, usually excludes behavioral health organizations due to a lack of a clear definition under the law. And in terms of reimbursement, unlike FQHCs and other safety net health providers, behavioral health centers have had to string together the funding for their services. So the Excellence in Mental Health Act builds upon the ACA by addressing the coverage and reimbursement gaps in the coordination and provision of behavioral health care services. So the main provisions of the Excellence in Mental Health Act are as follows. It first establishes a criteria for certified community behavioral health clinics. similar to what a federally qualified health center has in terms of criteria. It basically creates a set of standards for the scope of services, community partnerships, staff, and availability and accessibility of services at behavioral health care centers. The Act also provides $25 million in state planning grant funding for the purposes of developing applications to participate in the 2-year pilot program. So states that receive planning grants will be eligible to apply for what's known as the Excellence Act Demonstration Program. It's a 2-year pilot program that enables 8 states to apply to be selected. The pilot program allows for 90% FMAP for services. The Act also mandates that participating states develop a prospective payment system for required services reimbursement for certified community behavioral health clinics. So this is the timeline for the implementation of the Excellence in Mental Health Act. By September 1st, 2015, HHS will release the guidance related to the certification process and setting up of the prospective payment system. The release date for the RFP has not yet been established, but it may occur prior to or after this date. By January 1st, 2016, state planning grants will be awarded, and by September 1st, 2017, there will be 8 states that are selected to participate in the demonstration program. And these states will be chosen from among those that were awarded planning grants. So next, Kimberly will provide information for assisters and navigators for next steps helping consumers use insurance coverage in Section 2.
Thank you, Whitney. So now that many of you are assisters and navigators that are present on this call or providers, and now that you've completed the process of helping a consumer gain insurance, you may be wondering what are the next steps for CACs and navigators beyond helping American Indian Alaska Natives consumer enroll during the monthly special enrollment period. So in this last section, I would like to talk about a few tips that you can take to help behavioral health consumers in using their coverage. It's important to understand that your role as an assister is ongoing. There are several post-enrollment assistant tasks that can be accomplished as listed here. However, although there are several tasks, for the purpose of this webinar, I would like to focus on this first area, which is helping consumers with questions related to the utilization of their coverage. Assisters will need to be available to help with utilization questions that may come up for the newly insured. This may be a consumer's first time navigating the system, so it will require new resources to guide them. These are 5 simple steps that you can provide to consumers to help them understand how to use their insurance. The first is understanding your health insurance. Second, find a provider. Thirdly, request any necessary referrals. Fourth, make an appointment. And fifth, ask questions. Now let's go a little deeper into detail on these steps. It's important that consumers understand just what is covered under their policy in order to move forward with the remaining steps. So you will need to ask a few questions of the consumer to find out if they understand the plan that they have chosen. These questions will also be important for them when arriving at an appointment. So questions such as, how much is my copay or co-insurance? Is a referral required to see a specialist? Is there a limit for specialized services? Keeping in mind that a referral may be needed to see a specialist for care, especially for behavioral health services, and may require a primary care visit first. So when in doubt of not understanding any of these questions through looking at the consumer's plans, you should always ask them to reach out to their insurance company. as well as they can also talk to their employer's benefits administrator if they're under an employment or shop plan. It's also important to note that other CMS health services, such as Medicaid and CHIP, are still open for enrollment year-round so that those children and adults that are eligible can obtain health care coverage. Although all states did not expand Medicaid, your state may be in negotiations to take part in the near future. So please continue to keep an eye out for these important legislative changes that could take effect. Although Medicaid benefits vary by state, all state Medicaid programs provide services for behavioral health. Medicaid can cover a wide range of services depending on the plan a consumer is enrolled in. So here are just a few examples related to behavioral health. For instance, under Part A, it could cover inpatient mental health care services that you get in a hospital, whereas in Part B, it could also help in covering services outside of a hospital, such as visiting a clinical psychologist, any lab tests, or even having a visit to a psychiatrist. And then also in Part D plan, it could also help cover drugs you may need to treat a mental health condition. So it's important to note that that consumers may also have questions concerning their Medicaid or Medicare plans around their mental health and substance use disorder benefits. So the second step was to find a provider. Although this could be a complex decision to make or to help an enrollee make, an assister could help them understand the process of selecting a provider. Remembering to mention that names of providers can be found online through an insurance search engine. You can even call the insurance itself, using the consumer handbook that they're provided with, or even a word of mouth referral could also help them in selecting whom a provider could be. You may need to emphasize that there are added resources, that the added resource of being able to call a doctor's office to ask questions may make the process easier as well. They would need to know if the doctor was accepting new patients, or if they even live, or if the location is even near to their home or their work, or even if the working hours could fit their schedule. These are important questions to ask a doctor's office when deciding on if it would be a good fit for that consumer. Please note that you are able to change providers even if you're assigned by your insurance company, and that you may be able to keep your current mental health provider. So informing a consumer of these two notices are important for them to understand that the current insurance that they have enrolled in may still be helpful to them in meeting their health care concerns or their behavioral health care concerns. As mentioned previously, behavioral health services may require a PCP or primary care physician referral. However, there are some preventative services that a PCP could provide, such as a depression screening or even screenings for assessments for children. In this new era of patient-centered care, where a patient is assigned on a team of care coordinators, these screenings are helpful because most facilities combine data from all areas of care. So even if a specialist is needed, the information is in their record for others on the team to view. This allows for coordinated care and communication with all caregivers involved, which is an integrated approach. So the integrated approach actually benefits the behavioral health patient, mainly because these behavioral health issues could affect an individual's overall health. So knowing that there could be a dependency issue for a patient could show some co-occurring issues that they see that could lead to their lack of staying on their diabetes medication or management. There are also behavioral health issues that can affect one's ability to follow a treatment plan, excuse me. And lastly, behavioral health issues can affect work performance. So it really is an integrative approach to care to treat the whole patient. And we're hoping that more and more facilities are able to move forward in this type of practice. So thirdly, the next step was to request any referrals. It's important to understand that a referral could be required of a patient prior to seeing a behavioral health specialist. So in looking through that consumer's information card, more than likely it will help them in determining if a referral is needed to see a specialist. This also provides, on the insurance card, also provides the contact information and also could provide recommendations when calling the insurance company on what type of referrals are needed. And then lastly, referrals are helpful in making an appointment for the visit. And fourthly, making an appointment. I think this is pretty straightforward. Once you have performed the 3 previous steps, that consumer would be able to then make their appointment with that specialist to receive care. I did want to also mention the From Coverage to Care initiative that CMS's Office of Minority Health has actually recently implemented and put forth. It's through the Centers for Medicare and Medicaid Services, and it was created to help consumers understand their benefits and to use them appropriately. The website is listed here, and it'll also be listed later in the webinar in the resources section if you're not able to take it down now. But it is, you do have the ability to order materials from CMS that you can provide to your consumers and to your clients that can help them in understanding just what the process is in using their coverage, and also understanding for those newly enrolled insured patients, really relieving them of some of the stresses and pressures of trying to determine what the next steps are. I would like to also mention that these materials can also through CMS can also be could be created so that your facility could also be recognized on them. So your contact information could be placed on this information as well. The From Coverage to Care initiative, this is the main product from that initiative, and it's called the Roadmap to Health. And it really is a step-by-step process that can help a consumer in understanding what are the first steps to using their coverage and to making their appointments and to receiving care. So I encourage you to take the time to download some of these materials on their website so that you could have them handy for clients that come in that are newly insured. And lastly, the last step is making sure that consumers understand that they are able to ask questions, especially after having that first appointment with their doctor or with their specialist. They may need to ask questions in order to make an informed decision on whether that provider is a good fit for them. It's important that they are comfortable and they feel that they have received a good quality of care from that provider. And in order to make that decision, they would need to ask questions. So just in summary, some of the 5 steps that were mentioned in helping a consumer in understanding how to use their new insurance plans would be to help them understand what's covered under their insurance, finding a provider, requesting any necessary referrals, making an appointment, and asking questions. So if you'd like more information on understanding more information on mental health services and the health reform and how it's related, these are 4 websites that could provide you with up-to-date information on mental health services through the ACA and through the Mental Health Parity Act. One place of note is the mentalhealth.gov. It actually provides you resources that you can download, as well as as I mentioned, the Coverage to Care initiative can also be accessed through that website as well. In closing, I'd like to provide you with a few resources that could be helpful in working with your behavioral health clients. As I mentioned, the CMS's Coverage to Care initiative that can be found on the marketplace. Also, on the marketplace, you can find a section on special populations. And this section can provide you with up-to-date information on American Indian Alaska Native resources, as well as up-to-date information on what some of the new benefits and ways of assisting consumers in the marketplace can be helpful through that website. And lastly, I'd like to mention SAMHSA's toolkit or their toolkit, which is located on their website. And this toolkit website actually has a listing of several types of resources that can help in educating consumers when you go on outreaching and educating activities that you could pass out to consumers, as well as have available in your programs and in your clinics that can help them meet their behavioral health needs. Is www.nakui.org, but also feel free to reach out to either myself or to Eric Jordan, who has been a great part of this initiative in making sure that our urban Indian health programs are advised and of all of the different and necessary strategies that are out there for outreaching and enrolling patients, as well as helping them with moving forward and increasing the numbers of enrollments and the ability to use the marketplace. We are available for technical assistance requests, and so if you are able to, please feel free to email us and reach out to us in that regard. So at this point, I'd also like to thank Whitney Hewlett, who is a TARC intern here that helped in presenting on this webinar. But I also like to open it up for any questions that you would like to discuss. Feel free to put any questions into the Q&A chat pod, which is located on that right-hand corner below the screen. And we'd be open to answering any of those questions now. As I mentioned, Beverly Lofton from CMS is available to answer any questions that were covered under that Coverage to Care program, as well as any other area that was covered throughout the webinar. We'd be open to providing you any additional information. And while we're waiting for anyone that would like to post any questions, I'd also like to mention that following this webinar, you also will be receiving a link to an evaluation survey, and we'd appreciate if you would fill out that survey, which helps us in understanding your satisfaction with the webinar, as well as addressing any additional topics that you may need more information on. So there is a question that's been posed about how to receive a copy of the PowerPoints. The PowerPoints will be distributed to those that have attended the webinar and or registered for the webinar within the next 2 days. So you will be receiving that in a follow-up email. As well as you can also send me an email if you would like that information a little bit quicker. I also wanted to check to see if Beverly's mic is open. Beverly, are you still there?
Yes, I'm still here. Hi.
Okay, thank you. There was a question that's asking, will consumers that are already enrolled in the marketplace have to re-enroll again for next year? And there actually was just a new ruling that was released, I want to say earlier this week, where they will not have to re-enroll. However, there is a process that will be happening where the insurance company, if they're already enrolled, the insurance company should be sending out information to them to make sure that all of their information is correct, and also to provide them with information on other types of plans that are available to them. And I don't know, Beverly, if you have any additional information to add to that or not.
No, I don't. That sounds right. That is more like sort of like a recertification process or something like that. You do not need to re-enroll.
Okay, thank you. Another question that has been posed is asking, are there any statistics regarding how many urban Indians have enrolled in ACA? And the answer to that question is, in the follow-up email, I'll actually send out the link. There is a product that has come out or that's been released that actually states the general population and as well as the breakdown of the American Indian Alaska Native. So I'm not sure if that will totally answer your question as far as the urban Indian population is concerned, but it does provide you an overview of the general American Indian Alaska Native population. And I can provide that in the follow-up information that will be going out. NCUI is working currently to understand a little better about what our urban Indian programs, what activities you have been involved in, and what the product of those activities have been as far as the numbers of enrollment. However, that is still in process, and so that information won't be available, I would say, probably for another month or so. There is a question that's asking, is there an expert at SAMHSA or NCUI on the ACA that we can access? The information, and I'm going to scroll back up, and I don't think it was on there, but the information for Beverly Lofton would be a good access point. Beverly, do you mind? I'm going to actually place your email information in the chat box. Is that okay?
Well, actually, I'm with CMS, so I'm with the Centers for Medicare and Medicaid Services,
Okay.
and I
So
think you're asking for AMSA.
yes, they were asking about all of it. I'm sorry. So I will, I can definitely provide information on whom to reach out to for SAMHSA. As far as NCUI is concerned, I believe reaching out to me would probably be the best contact information. And if there are others in house that I'm unable to answer the question, I will definitely pass that information on. Another question that has been posted is, I'm sorry. How should we approach patients that are not eligible to receive subsidies and our state has not expanded Medicaid? They can't afford to pay high premiums. We find this often in South Dakota. And I think I'm seeing the whole message. Um, so once again, So how should we approach patients that are not eligible to receive subsidies and our state has not expanded Medicaid? Beverly, do you have a response to that?
Okay, so I don't see the questions, but the question is if your state has not expanded Medicaid, what do you? I'm sorry. Can you repeat that question? Because I don't see it
I,
on my module. I'm in the general module.
yes, I can repeat that for you. How should we
Okay.
approach patients that are not eligible to receive subsidies and our state has not expanded Medicaid if they can't afford to pay high premiums? So, what is the recourse for someone
Again?
that's not able to cover those premiums, but they are also not eligible for Medicaid?
Well, we've been encouraging situations like that. We've been encouraging people to still try to apply through the marketplace. Because you may receive some either low cost or no cost plans. So, and even if you're American Indian or if you're American Indian and you're federally recognized American Indian under federally recognized tribe, there may be some plans that are at very, very low cost and no cost sharing as well. So we've been encouraging people who are in those states that did not expand Medicaid to still apply. And just, I'm not sure if we mentioned that the open enrollment date or dates for 2015 is November 15, 2014 through February 15, 2015.
Thank you, Beverly. And then if there was a follow-up question to that, please feel free to type in the Q&A box. Um, one other question that came up is asking, do you know who the expert is at IHS? And so I would point towards there are there is an ACA Q&A call that happens bi-weekly that's ran by Jeffrey Roth. And so he has been an integral part of putting out information on the ACA through IHS, and I believe that he would probably be a good contact for you to look into. And I can, if you can, and actually, Gary, I'll send you that information directly. Has been posted is if individuals are under 100% of federal poverty level, they don't qualify if the state did not expand Medicaid. Did Beverly indicate they still should apply?
So the question is, if a person is at 100% of the federal poverty level, should they still apply? Is that the question?
Yes,
Okay.
because
Yes.
they
Yes.
don't qualify for Medicaid at that point.
They- Okay. So they don't qualify for Medicaid, and the state did not expand Medicaid. Yes, because you still could a person in that particular situation still could qualify for some cost reductions through the marketplace. So it's still a good idea to reply because that's almost the only other alternative.
Thank you.
And also just to add to that, if a person does decide to apply, they could just go through the whole application process, and the system tells you what you qualify for. So then at that point, they can decide if they think it's worth it to complete to go through the rest of that application.
I also want to add that if these patients are not meeting the minimum to amount to receive assistance, and they are not able to afford the premiums that are provided to them through the marketplace. I know that this is a, a gap or an area where there really are there is a great need for those to advocate for those states that have not expanded Medicaid to do so. Um, the at this point, the only alternative would be for that person to either access a fee for service, or if they are eligible to receive care at an urban Indian health program or a Indian health service clinic, they would be able to do so through those means without cost. However, if the individual is eligible or unable to obtain insurance, we are encouraging them to do so, because it also helps in funding that individual clinic and providing them with extra resources in order to provide care to others that are likely in that situation that aren't able to also purchase insurance. It also expands services that are provided from through that clinic when those reimbursement dollars come in. Gary mentioned that a lot of people don't qualify, and he does always try to tell those eligible for ACA that they should consider applying because it will save dollars for those that don't qualify. And I think that's definitely a good approach in that situation. At the top of the hour, and I believe I have addressed all of the questions. If I haven't, please feel free to send it again. Once again, there will be a follow-up email going out, and I will be sure to provide the PowerPoint presentation as well as a link to this recorded webinar. And I'll also provide resources to the experts at SAMHSA and IHS and CMS so that you're able to have those contacts.
Feeling as though they're pretty much low income, but do not qualify for Medicaid. You should also check with tribal leaders in your area, because through the Affordable Care Act, some tribal leaders have decided to have premium sponsorship programs where they sponsor and pay for the premiums for some tribes and tribal members through the marketplace, of course.
Oh, thank you, Beverly, for mentioning that. That is a great point, and it is an issue that's growing traction as far as tribes sponsoring the premiums for their members. And I know that there was a recent webinar, I believe last week, that covered that topic. So it is something that could be helpful to some, but definitely not to all, especially if everyone doesn't take part in that, the ability to do so. But it is definitely an option for those that are eligible.
Yes, CMS did sponsor a webinar through our contractor. I guess that was last week. And
Yes, it's the website that Beverly mentioned is actually cmsitutrainings.net. So at this point, I actually want to once again thank Whitney for being a part of this webinar, as well as Beverly for being on call to answer the questions that have come about. Um, we appreciate you all attending and joining in this webinar. And as mentioned previously, a follow-up message will be going out shortly with the evaluation link, as well as some of the information that was requested earlier. So thank you, and we appreciate your attendance, and have a great day.